sa assessment, kani siya ginagamitan nato o kanang plain normal saline solution. Uban sterile water. Pero accordingly sa training regulation, mo gini siya ang naa sa procedure nila. So kita beta ding solution naman ta madugas. Kani sa apti kaayo plain normal saline solution, o sa pang betadine. Pwede na ganit kaning normal saline solution na. Pero sige lang. Ito na lang ni awatong tanan. Para ma-satisfy din siya ba. Isa ha. Okay. Ako lang din siyang Hindi ka lang mag-practice, mag-work. Kapahulog na siya. Okay. Sige, start ko. Good morning everyone. I am Sheena Yu and I'll be demonstrating on how to perform the wound dressing and splinting. So when you say wound dressing, it is application of a sterile pad to prevent infection, or there is a protection against any harm, no, kay naamang kay sampong. And then when you say splinting gani, that is the use of this device. This one is a the triangular bandage and the splint boards. Ayun, splinter ha, splinter ba? Splint boards to immobilize the area. So when you say immobilization, that is giving time for the wound to heal. So that is for wound healing, faster wound healing. Okay, so what are the materials needed? We have here the kani sterile gauze man ni siya. Yes, pero kani rolled gauze man ni siya, no? Pero pwede kani ang gagamiton sa assessment. So kung kamo makadala pud mo ani, pwede ra pud kamo yung gamit. Pero pandigi lagi. Ayo kamo ta. Okay, well, then this one is a gauze bandage. This one is a plaster. Then this one is our betadine solution. So we have here our 3 cotton balls. One with soaked with plain normal saline solution, the dry cotton ball, and the one that is soaked with our betadine solution. This is the bandage scissor. Then, guys, depende na sa inyo kung ano sa inyong picking forceps ano yung dressing. Akong ginagamit magud sa dressing, up picking is this one. This one is the dressing. But both of this one are dressing forceps. So, kamo na mag-igo sa gatik. But interchange, basta kay the principle is sterile to sterile technique, which is gamitan yun og forceps, then transfer, kay kani siya for picking, kani siya for dressing. Hindi siya pwede ma-interchange po. No? Kay contamination naman na yun. Okay, so, and then the waste receptacle, we have the rubber mat, we have also our gloves, then we have our splint boards and the triangular bandage. So first thing to do is to wash your hands, prevent the spread of infection, and then you are going to cut equal sizes of your plaster. So, may na lang nato, no, mag-inot ta, wala na. So, magputol yun mo. Ayaw mo pag-assume.
May pinutol na.
Oo. Pwede na ka magputol daan before ka mag-start. Basta ka i-mention lang ni mo nga nagputol ka. Okay? Then after that, okay. After that one is you going to wear your gloves. Actually, kani siya, pwede manini mo siya panundaan, putol. Pero ako mag-gloves ko, ay din ko mag-putol. Putla na daan siya, pwede rin siya. Kaya dapat sterile ni. Wait. Pa! Okay, then, after that one, you're going to wear your gloves. So, panindigan ninyo ang inyong gloves hang gidala. Basta kay sterile to sterile technique na. Okay, then you do the sterile to sterile technique. What is a sterile technique? Using your forceps. So, getting first your bilhin ninyo sa yun mag-review pero okay ra na. Yun ang akuan ta mo una. Tanan ra ba kayo? Wala mang binabagsak po sa akong ipangkuan kay gina-push magsada ko nga mag-practice. Practice. Then transfer to the dressing. If kani siya gitahi lugar, pwede na siya from top to bottom and then in a circular motion. From inner to outer to prevent cross-infection or cross-contamination. And then you discard. And then the next one is a dry cotton ball. And dry cotton ball, imo lang siya. Diba? Kasi guys, wala siyang sulot ka na. Kung kamo. Okay. Then, you just pat dry lang. Mura gyapon siya from inner to outer motion. And then, after that one is the betadine solution. Okay, so for the betadine solution, that's the same gyapon siya nga motion. Okay. Okay, transfer lang ha from inner to outer. Circular motion to prevent cross-infection and cross-contamination. And then after that one, you're going to put the gauze and then remove your gloves and then apply na dayon ang imong plaster. Ano siya? Okay, para dili mo pilit sa imong gloves. Kay basin, maindir na ka, giaway nimo ang plaster. Malikas na dayon ka. Diba? Nakasala na na dayon. So, muna siya ang atong wound dressing and splinting. Sige lang, kailangan na siya. Wound dressing. Atong wound dressing. Now, for the splinting, ang splinting is used when there's a broken bone or where there is a severe sprain or strain on a limb. And that is one question sa assessment po. Under sa child care activities, no? Procedure. Daghan lagi kaayo, guys. Munang as early as now, tunin na ninyo siya para dili mo mawala kung hinina mo, actually kung pangutanon mo anak, mawala yun kay malimot yun, makulbaan ba yan? Ano, masking nag-CR mo, matulog mo, tanatanawa lang good, basta-basta pag may time. Okay, then you're going to do the square na technique, right over left,
Left over right.
left,
Over
left over right. Okay. Ako again. Right over left. Kung unsay gitanday nako, mo akong birahon. Gitanday nako ang right, akong birahon ang right. Ayon na siya tuyok-tuyok ka ha. Ana na siya. And then you're going to do the left over right. Sige gitanday nako, mo akong birahon. Then that is the square knot technique. You're going to document all that you have noticed from the wound itself. Then, after that one, you do the aftercare, you wash your hands, I'm done. So, ang doon lang asesor sa imo ha, iya din siyang puwason. Kung dili na siya magpuwas, again.
Thank you for coming.
Yes. Again. Okay. Sige. So, that is it. This one na ta, and then ako na siyang kiwason. Later on na din ta sa bed making ay sa benta. Okay, kajut lang ha. Pwede na dito dapit. Na. Itong electric fan na. Good morning everyone. I am Sheena Yu and I'll be demonstrating on how to perform the infant CPR or cardiopulmonary resuscitation in an infant patient or victim. So when you say cardiopulmonary resuscitation, it is a life-saving skill or an emergency procedure. It is a combination of both cardiac compression and artificial respiration until the heartbeat is restored. So what is your purpose? That is to bring back the circulation towards your heart, your brain, and other vital organs in order to save the life of our patient. So when you say infant CPR, these are the materials. We have here the infant dummy, the rubber mat, the alcohol, the cotton balls, and the waste receptacle. So first thing to do is, of course, to survey the scene if the scene is safe. But before that, we're going to sanitize the mouth of our baby. So mag-sanitize ta, mga tanang i-sanitize mo na nimo because mag-blow manggod ta ani, pero since pandemic days man ta, dili na ta allowed. Okay? So, and then after that one, you survey the scene if the scene is safe. If the scene is safe, then you are going to approach the crowd. No? Then you are going to introduce yourself to the bystanders. Hi, I am Sheena, a trained first aider. Can I help? If you are allowed, then you are going to check the responsiveness of the baby by tapping the sole twice. Hey baby, are you okay? Hey baby, are you okay? the baby is not responding, then you are going to activate medical assistance. You call for help, you call 911. Then after that one, you're going to check ABC sa ta ha, ABC sa ta. Dili sa ta magkab. No, ABC sa ta. So airway, breathing, and circulation. Airway, if there is any obstruction, so sa atong baby, it should be in a neutral position only, ang iyang head position. And then if there is obstruction, you're just going to finger sweep in a circular motion away from you using your little finger. If there's none, then you are going to check the breathing. Check the breathing for 10 seconds. So, check the breathing for 10 seconds in an LLF position. How to check? LLF position. Look, listen, and feel. Look for the chest rise and fall. Listen for the breathing sound and feel if there is air coming from the air passageway through your cheeks. Then you are going to count 10 seconds. 1, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. Victim, negative breathing. Then you're going to give 2 initial dose by giving mouth to mouth and nose. Seal. 1, 2. Then after that one, you are going to check the circulation. No breathing. Negative. So you check for the circulation. Here sa atong brachial pulse. Then you're going to count 10 seconds. 1, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. Victim, negative breathing, negative pulse. Then it's time for you to give the proper CPR. So, naan na siya cardiac arrest, no? So, kung maghatag ka CPR, you're going to locate the compression side, which is slightly below the middle nipple line, using your thumb, your middle, and your ring finger. And then you give 30 chest compressions, 2 blows in 5 cycles. Then you're going to do the compression 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 1. And then you're going to give 2 blows. 2 blows. Then after that one, another cycle. Pila ka cycles sa assessment? 5. 5 ha. Then 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 2. So, and 2 na ta sa second cycle na ta. Then, you're going to give blow. Then, LLF, blow, LLF again. Then, N3, N4, N5. So, 5 cycles yun ha. So, 1, 2, 3, until the 5th cycle. After that one, then you are going to notice that there is a sign of life, positive breathing, positive pulse. But before that, you are going to recheck the breathing and the circulation for 10 seconds. 1, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. Victim, positive breathing, positive pulse, meaning the victim is already alive. So you're going to bring the victim in a recovery position. What's the recovery position? First is the burping position, or the shoulder hold position, and you give 5 soft back rubs to comfort the baby and to improve blood circulation and provide relaxation to your baby. And then you are going to do the tummy to tummy position. That is to feel the warmth of your body, comfort to the baby, and then 5 soft back rubs, and then you do the sitting position. You just mention it. And then after that one, you place the baby back to the flat surface, and then you do the secondary assessment. The secondary assessment includes a DCAP-PTLS, or the head to toe assessment. DCAP-PTLS using your gloves. Pwede na ka mag-gloves ani. Then you are going to do the DCAP-PTLS, that is check for any deformity or discoloration, contusion, abrasion, puncture or penetration, burns or bleeding, tenderness, laceration, and swelling. Ako nang isulat, ayaw mong kabalak. Dayon, after that one, you're going to state the reason why you stop CPR. Istorya na na, total, pangutan-on nga po mo after. No? STOPS, spontaneous sign of life. There's a positive breathing and positive circulation. Then turn over to other trained professionals. Operator becomes exhausted. Physician assumes responsibility, and the scene becomes unsafe. So that is the infant CPR. You do the aftercare. I am done.